Hello and welcome everyone to another episode of Oral Pathology Tuesdays. This time with a twist. We have the dentistry special, which is once in 2 months. And considering that March is the month where the whole international community remembers and honors women, so this one is about women in dentistry. And I'm Dr. Mandana Donahue. I'm the founder of Oral Pathology India, and I bring you this channel essentially to promote oral pathology. So, today with me, the women in dentistry that are going to be talking to us are, one second, yes. So, we have four very successful women from dentistry. We have Dr. Amala Ram Manohar, who is an orthodontist. She is an academician, she is, of course, a researcher, and she is also a clinician. We have Dr. Sonal Thambekar, who is a periodontologist, and she also has her own charitable clinic and does many other things. Then we have Dr. Simarpreet Sandhu, who is the oral pathologist in the mix, of course, besides me, but then I'm not talking today much. So, so she is the oral pathologist in the mix. She is also into academics. She is also into a lot of other charitable work and also into a lot of work as far as oral cancer goes. And she is currently the Secretary General of the Asian Society of Oral and Maxillofacial Pathology. We also have another colleague, Dr. Soumya Tripathi, who is an oral surgeon. And we felt that we need to definitely have an oral surgeon in the mix. And she's an oral surgeon who actually does main surgeries. So she is another one. And we are all going to be discussing things in life, things in career, how we got here. And of course, this year's International Women's Day theme is choose to challenge. Challenge whenever you see something is going wrong. Challenge does not necessarily mean to be to fight, but it can be very mild. But basically, we choose to challenge. So at the end, we are going to talk about the things that we feel need challenging in dentistry even today. So with that, I will just stop this share and we get on with the meeting. Yes, welcome everyone. Lovely to have you here. Yes, I am going to request all of you to turn to turn on your mics.
Thank you very much for having us, Mandana, on the show.
You're most welcome to be here and a great pleasure.
And
Hello,
nice to see
Mandana.
all the other people also. Some people from Belgaum too. That's really good to see.
Yes.
Yeah.
Good morning,
Thank you,
everybody.
man.
I'm honored to be with all my teachers and seniors, and I'm a bit nervous as well.
Okay.
No, so the pleasure. It's a beautiful morning, and yes, it's wonderful knowing that Sonal is also from Belgaum and Mandana is. And I've always known Dr. Mala, and it's wonderful knowing you, Soumya. So now I know you also.
Yeah. Same here.
Wonderful meeting all of you. Sonal, hello.
Hello.
I haven't said hello to you. So it looks like it's going to be a Cords and Belgaum meeting today. Two of us are from Cords and the rest from Belgaum.
And Mandana
Yes.
being the common connector between the two
Very
institutions.
true.
Yes.
Yeah.
Yes. The common denominator in there. Yes. I am. And the mix is also actually quite definitely chosen with a purpose. Essentially, we have, I think, representing four generations within dentistry. May not be very much apart, but nonetheless, a few years apart. Maybe with the exception of Soumya, I think, who is definitely much younger, but the rest of us are fairly close in age. But still, I think times have changed for each of us, and we the idea is to see how oral pathology, or I'm sorry, not oral pathology, sorry, scratch that, dentistry. Yeah. There's so much
Yeah,
of
you-
oral pathology on my mind. Okay, so dentistry as a whole, and maybe the way women's role in India and in dentistry and as a part of the STEM, and how we have reached where we are, and what are the challenges we had, and what are the challenges we want to avoid for our juniors, our young colleagues who will be entering the field. So let me go with Mala first. Mala, how did you choose? I mean, did your being a female have any role to play in your career decisions at all?
Oh yes, definitely. Being a female played a big role. For one, I becoming an orthodontist itself was a big, very much of a female decision, because my first choice was oral surgery. And even in my final year, almost everybody knew I wanted to specialize in oral surgery. And one of my teachers found out that I wanted to do oral surgery, and then he came up to me and he asked me, "Oh, so you want to become an oral surgeon?" I said, "Yes." And he said, "The only oral surgeon I know could eat a man for breakfast. And the little bit that we do needs a heart of a lion." So I said, "Okay." Anyway, what happened is I went to Calicut, Kerala to do my internship and met my husband there. And then I realized I was going to be in India and in Kerala. And what I saw over there, it was very clear to me that I was not going to be able to do what I would want to do as an oral surgeon to its maximum. So then I chose orthodontics because it just fitted well in my in combination with my husband's private practice, general practice, and all that. So it was. So had I been a man, I don't think I would have compromised at all. I would have gone all out and done what I wanted to. So, but these are all happy choices, happy compromises. I don't regret it. Given a choice once again, I would probably do the same thing. So it does, definitely it does make a big difference. And going along further also, I was very interested in joining academics, but there were no private colleges in Kerala. And I did not want to join the government service because my husband was already in the government service, and that would have caused a lot of conflict. We would be posted in different places and all that. So then finally I just did private practice for 10 years. And then later on, I joined academics, as Mandana knows, very late, 10 years later. And that again, was a big setback because I had to really face a lot of conflict at that time, professionally, intellectually, and seniority wise, all that. It makes a difference when you get into the fray 10 years later. It does, of course, make. So that way, of course, it has. And then I've had to really work double hard because I started late in academics. But otherwise, those are the choices that I've had to make being a woman. That's how it goes.
Yes. And I believe you were maybe about 5 or 6 years ahead of us in time, ahead of me and Sonal, because we are batchmates.
Okay.
So I'll go with Sonal now. So Sonal, in our time, what do you feel? Did being a female make a difference to your career choices?
So taking up dentistry was not a choice because I was a female or a male. It didn't matter. I just wanted to do dentistry. That's the reason I took it up. Yeah, but when I went to the post-graduation level to choose a field, periodontia was easier because I could have cold cases. I didn't have any emergencies like oral surgery. Exactly the same thing what Mala said. Same problem. But I don't think so. Being a woman has really influenced that so much. It was more as a personal choice that I didn't want to do any emergency work and I wanted to do, routine dentistry. That's the reason I took up perio. It's not because of being a woman I've ever felt that I need to do something different than what if I was a man. I never ever felt that way. Unfortunately, throughout my career also, I've not felt it ever that because I'm a girl or I'm a lady, I'm not able to do what a man cannot do. I think it's the choices that you make. It's not
Times
about being a
changed.
man or a woman. I've never felt the difference, honestly speaking.
I think we will see how the progress of time has happened. Yeah, I'll go with Simar next. Simar, what about you?
Yeah. First of all, Manna, can you hear me? Because I've taken my microphones off and I'm
Yeah,
talking
I
from.
can hear you. Yeah, we
Okay,
can hear
fun.
you.
So I feel freer now. So for me, yes, I agree with Dr. Sonal. I've never really felt when I went there to, go out there into the field that I was a woman or there was any man hampering me. But what happened was in my case was the specialism was not initially my choice. my father was director of this dental school, and he told me, rather, I was told to only do one specialty because Punjab and whole of northern India didn't have oral pathology. And you'd be surprised to know, till date, both the dental schools, whether it's Government Dental College Patiala or Government Dental College Amritsar, we do not have a vacancy. There's no oral pathologist there, not even a single soul out there. And I've been waiting forever to get the opportunity to serve in the government sector, but the vacancies never came, and it's 20 years. So for me, I went there. I didn't know what I had to do because I didn't know oral pathology. Nobody had taught me in the Government Dental College Amritsar. But when I went there, I primarily met women bosses, a lot of women in dentistry. So I never felt, I think men are more endangered in oral pathology as compared to women. That's what I feel. Yeah.
That is actually true. Yes, yeah, that's true. Yes. Especially with time going forward, that is true. I think we will replace most of them. Yes. So let's see now, Soumya. You actually went on to become an oral surgeon way down the line. So
Yeah.
what about you?
Yeah. So like Mala ma'am said, so when I showed interest that I want to go ahead and do oral and maxillofacial surgery, so the first person who had doubt was my mother. Though she is a very strong lady, she's not like, but she was like, you will not have a family life and, erratic work hours, because my father is a physician. So it was more out of concern rather than any, doubt on my abilities or things like that. But the person who supported me was my father. And when I see my other colleagues, non-medical or other cousins and friends, contemporary, like my generation, erratic hours now, if you are ambitious, if you want to do something, like even if you're working in call center, I don't find many people who are working like 9 to 5, unless you are maybe a primary school teacher, probably. Not to even, I say that they are doing any less. But in my generation, I see in whatever industry or trade you are, even if you're doing a business for that matter, somehow you have to make a balance. And time is, I don't think anybody is very, even if you're working in banks, any field for that matter I can think of. And coming to medical or dentistry, so not only dentistry, but if you see an OGCN or, any other medical, a lady doctor, I don't think time or family, making a balance between job and family, it is challenging for everybody else. So I don't think it is anything unique to do with maxillofacial surgery as such, being a woman and maxillofacial surgery. So our generation has to somehow find a balance, and you have to work extra hard for sure. Another thing is our generation men also, they understand, and I think they cooperate with other things other than work. And then, so for me, it was not very difficult to choose and continue.
Yes, definitely. Things changed with time, definitely.
Yes,
I think even
yes.
for, if you really think for even me or for Mala, so we were both married and we were both working in Davangere away from our homes.
Yeah.
And we had all the support that we could get. Mala is still continuing there full time. So yes, it makes a difference. But it has changed. There has been a little change in time. So, okay, so let's say we went through your choices. Now, having entered the field, what about reaching your goals? What were your goals, and could you really reach them? Do you feel you reached them as easily as you would have as any male colleague with a similar training and a similar years of experience? So, let's start at random. Let's start from Soumya this time around.
So if you ask me in terms of, my answer cannot be applicable to every person, because our families are different, our abilities are different, and sometimes we are in right place at right time. So that we have to understand. So when I see my other colleagues who are maxillofacial surgeons, so few had children very early, or their family was not very supportive. Few chose to, get set and then start family maybe. So it's whatever may be the case, there will invariably be a difficult time of, let's say, 3 to 4 years that might not be there in a man's life. If you keep that aside, then in terms of training and to be able to deliver the work after, I don't think there is any difference. So it's not like if it is something very masculine kind of work, or only a man can do that. Just because we are also expected and we have to do it. Like I would love to do it. Any lady would love to do, like, the time or you have to give for a family. But I don't think it is forever. It is for some time, 5 years, 7 years. It varies depending on your family support. But if we talk in long term, like once you are okay, once it is like, maybe children are grown up or you find the right place to work, when you are able to do it, after that, it doesn't make a difference whether you are a man or a woman.
No, it doesn't make a difference to you doing it. But what I meant
For
was,
me,
what
it
I
didn't
was
make a
asking
difference at all.
is, do you feel like, for example, being given an opportunity to do a surgery entirely on your own, let's say, did it
Doing
come
a
as
surgery-
easily to you to
doing a
as
surgery and
entirely on your own, where you are the main surgeon?
so here in this hospital, it is a corporate hospital. I'm the only maxillofacial surgeon. I do all the maxillofacial surgery cases which come, other than like trauma, pathology, and I also run a smile train unit where I do all cleft related surgeries. So of course I'm able to do because of my training.
That's true.
So that any case, I mean, whether it doesn't make a difference, even if you are a very smart man, you need a training. Minimum basic training is needed.
Yes.
And after, I don't think it makes a difference. And why we have to see only maxillofacial surgeons? I don't think, for example, if we see the work of an logician, 98% they are women. Do you think all those surgeries, are they any easy, or they are less demanding in terms of time, energy, or intellect, or acumen? So why we have to talk so much about maxillofacial surgery per se? Any other surgery, ENT, there are so many women ENT surgeons. There are so many, I know neurosurgeons, I know women neurosurgeons.
Very true.
And
Very
you
true.
see here now everybody is talking about women coming from Air Force. So I think, other fields, trades as well. So I don't think it is any more a matter of discussion whether women can do any kind of work. But the men with us have to be sensitive enough to understand that at one point of time, we are required for somewhere else as well. And then when we take that, I cannot call it a holiday, but a break, maybe to give some more time to family. That should not be, we should not be at a disadvantage. Rather, it should be given its due,
True.
Yeah.
No, there's never a doubt that we match what can anybody do, but it's just that whether it is more difficult for us to be given the opportunity to do it.
In
That's
fact,
the
when someone
only
asks
thing.
me if you are able to do it alone, being a woman in surgery, I'm rather more surprised that why do they have a doubt like that? So when you see a lady pilot, when you see a Sukhoi, fighter pilots, they are women. Why do you have a doubt that a lady cannot do a surgery?
They shouldn't. Definitely shouldn't.
No, why?
Okay. Yeah. True. Okay. Let's see in the other fields. Let's go now with Sonal. Sonal. So what about you? What did you feel that whatever goals you had in your mind for yourself, did you feel that reaching those was in any way affected by being a female?
So there are different kinds of goals. You have personal goals and you have professional goals. There are two different parts of your life. Personal goals, we all just want to settle down, get married, have a family, have a life, in whatever way, whether you have children, don't have children, everything is variable. And professional goals are, since we've all done our dentistry, we would like to either work in a hospital or work in a clinic. It depends upon how your perspective is. So I always wanted to have a clinic. My goal was to have a charitable clinic. That was very, very important for me. And probably that's the reason I had joined the medical field initially, since I had some grandparents who had passed away without any medical care. So it was a big important thing for me. So when I started my clinic, so it's like this, okay? When men treat you the way you project yourself.
Yeah, true.
Okay, if you make yourself important, they think you are important. The minute you say कि नहीं चलेगा आज मैं नहीं जाऊंगी काम पे चलेगा, then they'll say oh आज मत जाना. Okay, so it depends on how you are projecting. If you think that your clinic is really important and your patients, your timing, your space is very, very important, they will take it how you project yourself. And in my case, I've been fortunate. My husband has been very, very supportive throughout. And I have been supportive to him. It's a one-to-one relationship. It's not that he's supporting me and helping me. I'm helping him equally. So it initially, yes, of course, there are problems when you start your clinic because you are trying to balance your home and you're trying to balance your clinic. But it depends on how you project yourself. If you say no, this is important for me, people will take you seriously and make it important. So I think what we need to do is we need to show that we are our work is equally important. It's not about oral surgery or orthodontics or oral pathology or being a fighter pilot. Okay, because we don't need physical strength. Physical strength is the same for men and women both. It's basically time management, which I think is a bigger problem with women than anything else. It's not about skill set. It's about time management because they think, oh, if you have the house, it's your responsibility to take care. The kitchen is running, children are going to school, everything. Um, so I think that's more important. But I think it's important that you have to show your importance. If you project yourself that, what I am doing is equally important. And of course, one more thing is there about how much money you make also. If you are financially putting in the same amount of money as your husband is, immediately the way they look at you is different. I'm not saying this from my personal experience, but I've seen people around me when I see, if you're not making enough money, you can't open your mouth. If you're not making any money, you can't open your mouth. I think all these things are more important than anything else. So I think these two things about projection, how you project yourself and how much financial implication also it has.
That is true. So let's hear what Simar has to say.
Okay, when I start again, for me, if I did a SWOT analysis on a young Simar who came from, I got engaged in BDS third year. And because my husband was immigrating to Canada. And then I got married in internship and I had a kid by internship ended. So I'm a typical example of how the support system in the family. So because I knew I was super ambitious, I didn't have to, I had to do something. I had to do post-graduation. So I made the gynecologist and this is interesting. So I made the gynecologist sign along with both my mother-in-law and my mother that she will do the post-graduation because I had seriously, I shouldn't be saying it here, but I didn't want to have the baby, So they said, okay, you can't do that, but we promise we'll stand by you. And they stood by me. And so what is very important is that you have to have a very effective support system of women. And to this, we're very cliched when we say a mom supported us and my mom-in-law supported us and the husband supported. Here I would like to also acknowledge the the maid servant we had, the cook we had, and she was Shobha, her name was Shobha. So she was there for my children when I couldn't be, when I had to run and I was pursuing a post-graduation as a major support system. And remember, there were times when I was just staying afloat. And then whenever you get an opportunity, then swim with the strongest strides, then again. So yes, this will change because now I am a grandmom, and so my daughter's married and she has a baby. So I have all the time in the world now. I'm totally to pursue my career. So now the strides are going to be way, way stronger. So that is the whole story. Like Dr. Sonal said, that, whenever you get an opportunity, find the balance and you have to keep working. And I do agree with Soumya that even if we, me and Mandana are oral pathologists, believe me, the number of hours we put in, it irritates our husbands because even at 12, we were talking at 11 yesterday. And my husband is, for God's sake, I'm barbecuing. It's the last barbecue of the season. Can you come out? I said, just a moment. Me and Mandana need to share notes about a SOM webinar we just finished. So yes, the support system. and walking whenever you can and running whenever you get an opportunity. Believe me, it helps.
Yes, it does. It does. So let's go with Mala. Yes. What about you?
Yeah. So see, I'm not very disappointed with my professional career move, because I think I made the right choice. Being an orthodontist and being in my clinic and pursuing my goals was very, very easy. You know, being where I was, I could achieve everything that I wanted to. My only setback was I had to delay my entry into academics. So that was one of the things that was very important. You know, I could do everything. I could do surgical orthodontics. I could do everything I wanted to do. So that way, I don't think being a woman has affected me at all. And my husband was ever supportive. He never tells you not to do anything. In fact, lets you go and make your mistakes. He's that kind of a person. And like Sonal said, you have to give importance to your own career, to your own work. The moment you give importance, everybody around will start giving you importance. The only little regret that I had being an orthodontist and a woman is my patients needed me maximum during the holidays and on the weekends, and my child needed me also during the holidays and the weekends. So that really tore me apart, you know. So when my son was having holidays, I would have to send him away to my mother or to my sister's place so that he's looked after while I was, you know, because the holiday rush is really bad for orthodontists. So that was, and I was like torn apart with guilt most of the time. So that was I think the only minus point of being a woman and an orthodontist. But you can achieve everything you want. And in orthodontics, there's absolutely no difference between men and women. All the men have achieved what they want. Only thing is, probably in terms, because I was a little lagging behind in academics, I was not into the lecture circuit when my contemporaries were. I was not invited abroad when my contemporaries were, or at the national level. I had to wait it out, and you know, till I got my recognition. That was the only thing I had to give up, being a woman. That's all. Otherwise, it's been good. It's been great, in fact.
I just want to add something to this. I bought some furniture from IKEA last week, and there's an assembly service which you pay for. So they send two people home to assemble your furniture. So there's a girl and a guy, two people came together. The girl must be around 25, 30 years old, and the boy also. And they both were assembling the furniture, and they were doing the exact same thing. ऐसा नहीं कि मैं lift नहीं कर सकती हूँ, or she can't lift it. They both were doing equally the same job. So my maid said, Didi, अरे लड़की लोग carpentry कर रहे हैं. I said, there's no problem. It's because we are thinking that we can't do it. That's the reason we're already shutting that door. Don't think that you can't do. Everybody can do exactly the same thing. That the same skill set is required for everyone. It's not that you know, just being a lady, you can't do something.
That is true. But you know, the question, I think, what is mostly and what is now recognized otherwise also, that even in the well-educated, the well-trained set of the science, technology, engineering, and maths, okay, that although the numbers of women are very high, and this is globally, it's got nothing to do with India, the numbers of women are very high. They're almost up to 1/3 of the numbers. But the positions of power they reach are very few in comparison to those numbers. So it is not so much that we need to recognize that we can do, because I think most women today recognize that they can. But I think it is about the people who are in power recognizing that the women can, and therefore giving the right opportunities to women as much as women. I'm not trying to say we are better than men. I'm trying to say we are equal. And if I have the right training, I have the right number of years, I have the right skill set, just because I'm a female, I should not go second on the list for anything. I should be able to match anyone with a matching criteria. And the decision should never be made on gender. But sadly, in a lot of places it is. Now, I will give you an example. I have worked in 4, maybe 5 colleges. Okay. Now, and this has been at a time when literally oral pathologists used to be stolen from each other's colleges. You literally get a call all the time being told, I don't care how much they're paying you, we are ready to pay you more. You just come here. There was even a time when someone told me, you don't even need to come here, just give us your name. And I said, wow, that I will not do. But the point, now, at that exact time, two of the colleges where I was already working at, and when I had already been working there, and I knew that people with the same experience were getting paid much more. When I asked them that, okay, we started at a certain pay level, but it's time you give me a raise. I'm not saying you give me a raise to those amounts, but generally a raise that is logical for me to continue staying. Okay. And this was at a level which was, I think, what I was already asking was, I would say, at least 30 or 40% lower than what colleges were paying to people of my equal seniority. Okay, and of course we know in India seniority is how we basically get in and get on in promotions. So at both of those colleges they did not agree. I walked out. They had to search for someone. They got someone paying a lot more. And I really wonder, would that conversation have gone differently if I was a guy asking for a raise?
Very true.
I don't really know that because there is obviously, I mean, it's now in conjecture, but it is a fact. Or even at the same time, when people would, the same college, it happened that the same college called me and offered me a certain X price, X amount. And then another oral pathologist called me and said, oh, I'm about to join that college. I said, oh, okay. They had called me. How much did they offer you? Oh, they, offered me X plus so much.
Yes.
So the very opening amount they decided to offer a female was lower. And these were, of course, people who did not know me. They did not know me by face. They had just found out that there is an oral pathologist existing so and so place. So their only idea of me or of that colleague was that this is Dr. So and this is Dr. So and so. So this one is a guy, this one is a female. And based on that much difference, so I mean, I'm not sure about it. I was in a place at that point that it didn't really matter. I was anyway refusing jobs everywhere and staying very happily at actually a much less amount because I was really enjoying myself in cords. But the point is that the difference existed and you perceive the difference. So this is what I'm talking about. Not so much that we should recognize what we can do, but whether others are now beginning to recognize and equally value the job that the females can do, as is possible. Uh, any thoughts on that? What you all feel? This was my own experiences. What are your experiences?
I haven't faced anything like that per se. Only thing is, when I did want to get into academics after 10 years, I had to sort of start at a much lower rate, just a contract amount when I joined. But I think that was more because I had no teaching experience and not so much because I was a woman. So probably that doesn't apply over there. But otherwise I haven't. And in cords we don't face this discrimination.
That is true. It is not there.
So that is why I haven't faced it.
So I had an experience when I just finished my dentistry and post-graduation, and I came to Bombay and I was looking for a job. So I'd gone for a job interview to one of the clinics as an assistant. So the guy asked me, first thing is that, are you married? I said, no, but I'm planning to get married. So you'll take time off? Then you have a baby, will you take time off? So looking from the other side, sometimes maybe it's also because in the college, it doesn't matter, but in private practice, these things make a difference.
Yeah.
Because of course we need to take time off. When you have a baby, you just have to take time off, or if you're taking time off for marriage. In the counterpart, the men they don't do that. And I think that's the reason also probably people look at women in a different way when they're hiring in an institution or a private clinic. It's just I'm trying to see the picture from the other side.
In fact, I would like to add something to what Sonal just said. When I finished my internship and I got married, I had to wait for a year to do my post-graduation. And at that point of time, I went and started working as a general dentist in a small clinic. And initially, I had a part-time job, and there was another male colleague who had a full-time job. And then when he left, they offered me this full-time job, but they were not prepared to pay me as much as they were paying the male counterpart. So then I just put my foot down and I said, nothing doing. If you don't pay me, I will leave. Then the owner, in fact, told me, see, women are not paid as much as men. And I was so offended. But I said, nothing doing. I'm going to leave if you don't pay me that much. It's just as simple as that. And then they ended up paying me that much. But yes, in private practice, even I've had that experience.
Yes.
Very true.
So if sorry.
No, you go on.
I have to get somebody in my clinic, the same questions I'm going to ask them again now. So if I had a dental assistant, if I wanted my clinic, of course I'm concerned. If I'm going to hire a woman, then I need to ask her, are you going to take some time off? Because I need to be prepared. Maybe because I'm a woman, I'll be more understanding about it and say, okay, no, she needs time. But professionally, yeah, it makes a difference because I need to be prepared if she's going to take time off for children, for, marriage, one baby, second baby. So all these things do matter, definitely do matter. Sorry.
Yes, Samar.
No, that's okay. So basically, yes, when we were graduating, from the dental school, they used to say, if you wanted to learn a skill, suppose more, there's like, don't worry about learning as much, you better be bothered about you getting married, So that back then, 25 years ago, it was there. But along the way, we are kind of facing it less and less. And I work in sectors which had a fixed salary for everybody by that grade. So there wasn't any opportunity of, though I don't know whether for the dean positions they would consider women. I mean, somehow, I don't know. For there, yes, because they had to go for meetings to different places and all. For dean positions, somehow, at a lot of places, they prefer men, saying that the men have to go for meetings and the orders and a lot of other things. So I don't know, because I have never wanted to be in that position, but that's what the other women say. So that's what I feel. Yeah.
Right. So what does the youngest amongst us have to say?
I have
the most recent generation.
So I have something different. Like, I never had any experience like regarding payment, like everybody is talking about. But I would like to tell my experience. So when we joined as a maxillofacial PG, so mostly they were boys. So first year PG, what do? We are half of the time, other than minor oral surgical work, you are doing some other work, like you are arranging birthday cakes, or we are booking someone's ticket. Unfortunately, it is nothing to be proud of, especially, in our academics. So what I experienced that within few months, the men, like boys, they got along with the staff, well, and I did not know how to figure out. They would go and, do other stuff. And then when it came to working place, they obviously, without me even knowing how it was working, the system, that how they knew everything, where the case is posted, they get more chance. I'm not telling that anybody was being specially mean to me or, I was stopped in any way, but of course I was not so comfortable. I was still behaving like the typical student, and they were more like friends. But then there were times, there is a small, I can't say incidents, but small unpleasant experience, like one of my seniors. So in first year, we used to have quota, that many surgical impactions, and then from minor OT, you would go, something like that. So what do? I had two other women colleagues. So we were 3 postgraduates, first time in maxillofacial, and they were told, like, this batch, ye to gaya, 3 ladkiyan aa gayi hain, they are good for nothing. So out of 6, there are 3. And we were like so badly offended. We were like, what is this? What is this happening? We are always sitting and they are doing something. I mean, of course, nothing related to patient. And they were already like friends. And then there was this senior. So I would go and find out cases, like come early and find out if x-rays were done and blood investigations were done and try to do case. So he just comes and, what are you going to do? Every day you are doing one case. And he said something, इतना excitement दिखाने की क्या जरूरत है, आगे चल के तो तुमको रोटियां बनानी है. Yeah.
Really? In your time?
In quads, I had this, and it is 2011. And I was like, of course, I didn't believe it at all. I was like, I mean, I had no choice. This hierarchy, senior, junior, there is a force against you. So you cannot even show that. Then I was like, what is he? Like, where is he coming from? How can he talk like that? And he took my, that entire, we would arrange, my impaction trolley, and you keep your instruments and you call your patients, everything you're expected to do. So all that he just took and he said, Tum chalo, you just assist me. I was very angry. I didn't take it like, I cannot do it. I was just very angry. I mean, I couldn't do anything else. And I mean, just holding back by tears, like because of anger, frustration. I don't know what is he doing today. I don't want to take his name because I don't want to give him importance. It is important to tell this because I don't know what is he doing today, but such things will happen. He couldn't stop me because I did not believe in what he was talking. And I don't think even making rotiyan or doing kitchen work or taking care of children or in-laws or family is anything less. You can do both. You can, like ma'am said, you have to manage time, you have to be smart, and you have to set your priorities. And for all the women who are, there are colleagues and women who are bad examples. I'll tell you that also, who want to behave like some delicate dolls. And I hate them. I mean, they should not come to such professions. And then they need that kind of extra protection, and they want to be treated like some lady. I don't know what they want, and they also want their work done that way. So we cannot generalize. So there are many good men and bad men and very strong women, and also these kind of women as well. So this is like a mixed bag you find everywhere, not only in dentistry. Even if you go in a group, if you sit and see how, group, they are cutting grass in the lawns. And if you see them, there'll be women who are working like they are so sincere, even if they're, cutting the grass, and there'll be some who will be just loitering around and doing, not being sincere wherever they are. So same way we have in every field. So it is up to us how seriously we take ourselves and how we want to, contribute to our family, to work, and what are your dreams and how badly you want to realize them. And then you make a conducive, like, people will come in your support wherever you are. People will come in your support. You will have bad experiences without any doubt. But it is up to us what we take from there. So that senior, when he told me, I just did not believe in him at all. Rather, he made me more adamant. I became like, I decided, okay, come on, how can he say like that? And I never felt the way he told it in a very derogatory way. Like, you have to go to your in-laws home and you'll be doing something. Why this degree and all? You're not going to use it. I don't think cooking for in-laws or for that matter, whoever, is anything less. So we don't have to take it, if you are having, like ma'am said, you have family, you have children, that is very, very important part of our life. For any career for that matter, whether you even we have had prime ministers who had family.
Yeah.
So it is not at all a matter of debate. I feel men who do such, who are creepy, to put it simple, they do it out of their insecurity. They can't see you, they cannot take it.
Yes, because I agree because men want to label, men colleagues, I mean, with due respect, want to label you. And they are unnerved by the hyperness, like Soumya said. then they want to trace it down to why is she so hyper? What is missing from her life? Why is she compensating? Or is she just plain mad? What is she looking for? What's wrong with her? Yeah. And our problem is we try to be super women. We try to be super dentist, super mom, super wife, super mother, and in Indian scenarios, super daughter-in-law. Yes. And in all this role playing, we burn ourselves out. And that is what we should not do. Remove your cape, be confident. There are lows, there are highs. There are so many things we've embarked on which are utter failure. There have been so many damages. I mean, we are just human beings and we are doing what we love. If anybody has problems, that is their problem. And this is what you learn when you come to our age, Soumya. So you will have to go through all the quotes and Robin
Sharma. I want to, again, having said so much, I want to make another point. We are talking about individual experience, but there has to be a minimum social standards. Like the system has to be such a way. Like, for example, today they have started making, whether you go to malls or you go to airport or even in a hospital, public places, they started making nursing rooms, baby feeding rooms, because there is somebody who thought about it. It is something important, and a lady has to do that particular work with dignity. So as a society, as and when we evolve, like ma'am said, in Mala ma'am's time, it was difficult. So I believe that we are evolving as a society as a whole. We are evolving, and things will hopefully become easier. But with all that, we will definitely have these, insecure and not very aware type of men who are so uncool.
That is true. And there are few, I have to say. I mean, we all know there are very few. That is not the main majority of men. But there are few. But the thing is, the human mind is built, not just the women's mind, the human mind is built sometimes where evolutionarily we have learned to remember negative experiences more than we do otherwise, which is why the actions of these men sometimes will stick longer, because that is your sense of self-protection clicking in and saying that next time you need to be more aware with this person, which is why it stays with you. It happens with everybody. But the point is that those few, we need to now, I think, like we can see now in our generations, things have changed a lot. And definitely dentistry has become a profession where women have a lot of voice. We have so many HODs, we have so many deans, we have, I think, probably even some chancellor somewhere who's a female. But the point is, now we need to mature further. I think the whole idea of a talk like this is to take it now to the next level.
Yeah, and also, see, we 3-4 of us have had a bad experience, but nothing stopped us, because probably we were, I don't know, inbuilt strong. We had a solid support system. But I am concerned there will be so many others who just could not gather enough courage, or there was not many people to support. Maybe a talk like this should benefit them, and they should understand, okay, so even those who are there, they also had such unpleasant experiences, but still they move on.
Yeah, basically time to tell for everybody who's listening, the younger colleagues, that you are beautiful, you're very empowered, you have it in you. Just get up and start your journey. And believe me, one of these days you'll be here sitting on this, and Mandana is going to invite you and you'll be in the talk session. Yeah. And I just wanted to quote one woman who really, like I told you, the niche created is by Dr. Sangeeta Reddy. And I don't know, you must have seen her. She's the FICCI, she's a doctor, and was the first lady to be, on the president of FICCI. And then I'm with Flo, with the FICCI Ladies Organization, and it's all about empowerment. So the point is also, to join join different organizations which also bring in the best in you. So that is why, and yeah, you all can join Flow. I mean, it's Picky Ladies organization. Very, very empowering. And I think I saw Sonal's friend list. It's Mallu Natarajan is there. She is presently the Flow Mumbai chapter chair, I think. So I meet a lot of empowered women every day on my virtual space. Too much empowerment. And it's wonderful to see them all. I mean, these women have started startups. They are running companies. And that is what really brings so much motivation every day.
Yes.
But what needs to be recognized also is that, see, when you are a woman out there at the same platform, there is so much more you need to do than the men.
Yeah.
Like what Soumya was saying, her male colleagues didn't have to deal with any of this, but the female colleagues had to deal with it. So we need to be far more efficient, we need to be far more organized, and we need to prioritize so much more than the men. For example, even when you are married and you have kids, it's, you are worried about the child's education, what the child eats, what everything, and you are late, you have to co-opt so much and make sure that, like you said, the maids are important, the in-laws are important, everybody is important. Because the traditional mindset of the men is that, they haven't, I think that the present generation, they do jump in and they do take care of the household responsibilities are also split. But in our days, it was not like that. We had to work, we had to do look after our house, we had to do everything. So it becomes a lot more difficult for the women, but I think that makes us so much more stronger, and it makes everything that we achieve so much more precious. So it's a fantastic feeling.
What you're saying is right. And one more thing, we don't need to feel guilty. You don't compare yourself to another man. Just because your male counterpart is working the whole day and putting in 10 hours or 12 hours, you need to put 12 hours. If you want to work for 4 hours a day and then put the rest of the time into your home, that's perfectly fine. You don't have to feel guilty about it. There's nothing wrong in it. It's a choice that you make.
Yeah.
Whatever you decide, don't compare yourself to the man and say, oh, because he's doing it, I should do it. I'm an achiever only if I can make this much money, or if I work for 12 hours, or if I attend this conference, or if I do that. It's your choice. Yeah. Don't compare. Compare yourself to yourself, not to anybody else. So if you work for only 2 days a week, perfectly fine. That doesn't mean that you are any less than anybody else.
Yeah, but the guilt comes when the conflict is between what you want, what your goals are, and what you think your duties are. So I always say, I tell my mother, it was very bad mothering. You taught me, didn't teach me the right things. You didn't teach me when to let go. I wanted to be as perfect as my mother and my mother-in-law, both of them who were great cooks, looked very good housekeepers, and, and looked after children so well. And then I still wanted to do everything in my profession. So the guilt comes there, So there also, there is a trade-off, you have to.
There's one little thing I need to quote. This is hilarious. So every time I used to be called as an examiner or conference, my mother would, normally I call her up every day. I would not call her up so that she doesn't catch hold of me, that I've left the children behind. So she knew that I am missing in action. I am somewhere. I would not pick up a call. And then next day she would tell me, you were out somewhere. I said, no, I didn't go anywhere. So she would cross. And I told her, I said, you made me ambitious. And when I reached the pinnacle, now you're telling me now you concentrate on your children. So yes, that conflict was always there, with my mom constantly telling me and monitoring me that how much am I missing. But then my husband was there. So that was at a house.
So to all the new professionals who get married, the first advice I give them is, don't be a superwoman. Don't try to be. Please get into the habit of saying no, and get into the habit of saying, I can't do this, or I can do only this much. That way life becomes so much easier.
You know what happens when we are newly married? So we want to be in the good books of everybody. So we set the standard so high, we can't maintain it for the rest of our lives.
And if we do maintain it, and if we do maintain it, it takes a toll on us.
Yes. So say no to few family functions. It's okay.
Okay, let me take the conversation somewhere else now. Okay, we went through whatever has been our life, and I think it is safe to say we are all very strong women. We have been brought up to be strong, thanks to our families, and we have also been fortunate and out of choice and out of good fortune and whatever combination of everything, also got into families where the support has continued, and we have been able to grow to wherever we wanted to. Now, but not everybody is like that. And I think this year's I was very happy with this year's that International Women's Day, which says we challenge, and I think that's what it's about. Sometimes it's now about challenging some stereotypes that have set in. Yesterday when we were talking, and Soumya had a very good point. I think she can share it.
Okay, I have to
Yes,
do
you
that.
can share it.
So from the beginning, like when I final year BDS and internship, I hated something. Whenever we had these CME CDE programs or in a conference, I used to and I somehow I escaped. I was never, so whenever we had this felicitation or a chief guest comes or a welcome, always there is a girl expected to drape in a very traditional like attire sari, and she has to give the bouquet or stand like, I felt like being used as an object. She has no presence of hers, only she should look presentable. And I never found a boy doing that. And everywhere now, even today in international conferences, if it is happening in India, you always find for the chief guest, if they have to give this shawl, she will come. And if you find out she'll be an intern first year PG, I'm like, why do we need that? Strategically we are, it is, and you can't say no. I escaped. I would want to keep myself busy with something else, where is someone where I can use my head. And I never liked it. Okay, first of all, I feel if you are into that kind of hospitality, and like I was telling in the morning also, and if you raise funds like in lakhs or sometimes in national conferences, it goes to crores, you better hire, these, get these agencies, who are into get some cheerleaders, pay them, let them do that. Otherwise, don't do that. And if you have to, make sure if there are 4 girls, let there be some 5 boys also well suited, and they should stand like that. Why? It is very personal. I don't know if everybody feels it that way, but I never liked it. I don't like it at all. And you find they don't even know they don't know clearly what conference. They are just there standing with a tray or some bouquet. And I don't want to take names because they are all big people. I know some girls coming and telling that they were not even treated well, like, so those, because they are being projected there like an object. You have to just look good and stand there. They are doctors. They are going to become professionals tomorrow. They are there supposed to be. Their parents have sent them, or they have come there with some dreams. Why are we supposed to do these things? Are they really needed?
Very true, Soumya. Now, not only that, what I feel is that we in
It's
India
just an
somehow,
example.
somehow we've even made a big deal about these inauguration functions and the graduation functions and all that. I really don't know. You go abroad, all the professional inaugurations are so well done. There's nothing like this. I studied in Manipal. We've never had a function where girls were made to do all this. It was even today. Recently,
they leave classes if there is a final year BDS or intern, and it will be some maxillofacial, some conference. So if, for example, conference is happening in Chennai, some 4 dental colleges, Chennai, I think last 1 week, they will not be even attending classes. So are those classes really not that important?
Correct.
Or they are some useless people. They should be just looking good. What are we doing? Why are we doing that?
Very true. Very true. In fact, I feel for a professional inauguration, we shouldn't even be getting, people. The people who are organizing to get girls to do all this. We should just do away with it.
I have to talk about boys. They are only picking and dropping guests.
Yeah.
Why even boys are made to do that?
Correct. It should not be.
Imagine they are going to be doctors, or you are expecting them to write a research paper, but their faculties are being used for such things. How do you expect? Why aren't these good, real research papers coming from India?
Yeah.
Because when a 18-year-old joins a college, you are draining their energies and brain and everything into such things. How do you expect them to think beyond? And you are ragging them. Yeah, it is ragging. So I have had experience, like so because I'm talking to all the professors, probably I can share my experience. So when I joined first year, there is a subject, dental material, and we were made to sit, and there I did not learn anything in my first year, and we were only ragged by these newly joined assistant lecturer. What do we call it? Assistant professor,
professors.
lecturer. Yeah, so they are like fresh
Senior
pass out PGs, yeah, senior lecturer. What did I do in my first year? Why we have that kind of environment? Why cannot we be more serious? Like, we are talking about something so serious, but it starts from there, I suppose. Nobody knows. I mean, a first year BDS or sometimes even first year PG, they don't know what they are doing. And suddenly, when you are first year PG, 4 years, I was expected to come with some synopsis or research topic for my dissertation. I was never even taught. I never even knew to go to library, to read papers. So why like that? It's something slightly away from the main topic, but then that kind of seriousness is not there at all. You are draining your resource, you are draining your time into such things. Very, very non-serious, useless, unnecessary thing.
No, there is definitely gaps in our entire education system, which needs to be updated a little bit. We are a little bit lagging behind times, and might have been good for its time, but nothing is permanently good. Change is essential, and I think time has come to change
Vandana,
a lot of things. Yes,
I don't think that we are a little bit lagging behind. We are lagging behind a lot, by a lot. For example, a woman who, like Sonal says, chooses to just work for 4 hours in her practice, wants to spend about 2 or 3 days teaching. Do we have that kind of liberty? We just don't have.
It's either very, very good in her subject.
Exactly.
She
exactly.
would be amazing academically.
Exactly. Very, very true. But that option just doesn't exist. It's all or none law. You either are a full-time teacher or you are not. I mean, come on. There has to be this kind of, a leeway. Our curriculum is just too rigid. That is the reason why even women are not doing research. You should have, like this year, I couldn't take postgraduates because I'm 60 and I'm on an extension. I mean, but there's no way I can do research anywhere else. There should be a platform where I can do research, outside of this entire curriculum. No, there is no leeway. So I think our system has to really change a lot. If more women have to be more, accountable, and more women can make a very fruitful contribution. I mean, everybody who is in full-time service is really not making a contribution. They are there. It's like any other job. You come in the morning, you do your job, you do X number of publications because you are forced to do it. I mean, your soul is not into it.
Like reading those papers. Those papers are written because for some points or some promotions.
Correct.
Now, not to offend everybody, but then
no, it's true. You're forced to do it because today at least the remuneration in the dental colleges, I would say, not anywhere good. It's like just average. So every woman also has to supplement her earnings by doing some amount of private practice. And with the private practice and with a full-time job, where is there time for any creativity? And the home, there is no time for creativity. When you come back home after all this, you still have the same routine to go through. That is where the men have an edge. They don't have to be worried about, क्या सब्जी लेना है, क्या पकाना है, किसका homework करवाना है, all that they don't have. So they have that much time, little more extra time to do these things which we don't have. So we get lost in a way. So
That's true.
We get burnt out. We burn ourselves.
Very
You know
true.
what I find is like we need to, what we want to do, it is like left, the things I was asking, parity, whether it's in pay, in authority, or in ability to be able to do your job. For us, if we want to do something, we need to be able to create it ourselves.
Very true.
Like I want to be in oral pathology. I have created an entire channel to be in oral pathology. So
Very
that's
true.
like really going extremes, but that's the way it is. Because I mean, I love teaching, but there is no way I can get an adjunct professor's job because
Correct.
no one is interested.
Yes.
So
No,
this
our
is all
system
a part
doesn't
of it.
allow it. That's the worst
Yeah,
thing. See, there are people in the US who are heading departments in Armenia. They are heading
Yeah.
here. You can't. I mean, I could be very effective in Kerala also going somewhere and doing a part-time thing, but that's not accepted. So
Yes.
it's very difficult.
There's a lot that needs to change there. Yes.
So
So
it's
that
not
is-
acceptable because
Yes,
you're a
Sonal.
woman, or it be not acceptable because you are you can't do it?
No, the system does not allow it. But
yeah.
what I'm saying is that the women would be the biggest beneficiaries if this kind of a flexible system existed. That's what I'm trying to say. I wouldn't have to be 600 kilometers away from my husband and my house and my practice just to be in academics. I could do something, over there. If the system was a little more flexible, I would be satisfied with that.
That is true. So that
we have
brings
to
me
come out. Sorry, we have
No,
to
go
come
ahead.
out from the colonial. We've been very influenced by the colonial, and the regime has left. So we need to be more, more forward in all our things.
And women policymakers who should assert themselves, not just run along and say yes to what the men say. All the policymakers are men. When did we ever have a DCI president who was a woman? Never.
Did we not? Never?
Didn't,
This is a
No.
point. This is a point.
Yes, this is where we were getting at.
Sometimes if they are women, by the time they reach there, they forget about women.
Very true.
That also happens.
Oh, believe me, even I agree with you.
Very true. Very true. I am super partial to my female employee, my staff. I am so partial to them because I know what they are going through. So when they come and they have a problem, I'm like totally supportive because I know what they're going through. But a lot of women forget. You're very right. They think, I did a superhuman job. Why can't she also? So that is a very
That I think is the whole point of saying that we step in where required. We step in. There was also, I mean, going out of course there was a very good point Soumya made that I do hope is taken into account for future events, is that you want to have people dressed up nicely. I do understand our Indian culture takes a very high point of making your guest, your guest is treated as God, and it is a way of being a host. I can see it that way too. But then your host has to be equally men and women.
yes.
You don't necessarily need to just dress up the girls and make them, yes. And you can also equally see that the girls are given other jobs that requires people to go up and down. I think those roles need to be now mixed a little bit. And yes, there's this old thing of sometimes sending, if if someone is traveling from somewhere, you send a PG along with them in the car. For I think all that is really obsolete and unnecessary. There is not a single person who has reached the level of being an examiner who cannot sit on their own in a car for 3 or 4 hours.
Or book their own tickets.
Or
Yes.
book their own tickets, or get on get in a plane or
Actually,
whatever.
ma'am, I feel we need to, people who do such thing, we need to talk about it, maybe make fun of them and make them feel that, make them actually feel awkward, so that, they just don't take it for granted at least.
Yes.
But
Maybe
you know,
sometimes, like you said, you cannot call police or complain for everything. We can have our own soft skills and, at
Yeah.
least they should be demotivated if nothing else.
Demotivated. Yes. Yes,
so,
Sonal.
Boys and girls both get subjected to the same thing. It's not only
Yeah,
women.
definitely.
The
Like
boys
I
also
said,
have
boys are made to
difficult
pick
time.
and drop and
Yeah, definitely.
Stuff
That's
like
what I
that.
said. All of these need to be just, we need to treat our youngsters with a certain level of, first
dignity.
is not stereotype them into roles.
Yeah.
And the second thing is definitely, I don't know, I had this while I was heading the department. Sometimes, of course, yes, we had guests arriving, we had, examiners arriving, they would be staying at the hotel. It was never one of my PGs who went to pick them up. It would be either me or one of my staff. We
Correct.
would be meeting. Yes, of course, like I said, a level of hospitality is there. They are in our town, they don't really know their way around. So we take them, we drop them, we pick them up. But I used to literally be half the time driving myself everywhere and picking and dropping everybody.
Yeah.
And, that is essential. So I think, but it should,
I need
why I would say staff and not PGs is because staff can inherently say no if they want to. PGs will find it more difficult to say no, but I would love my PGs also to any time to have said no if they wanted to. But the idea is, I think they may find it more difficult, so best is not to put them into that situation.
In fact,
So
I
I
think
just
the boys
wanted
have a
to.
worse time. They have a really difficult time. They'll say, oh, in the morning, go and pick them at the station, at the airport. In the night, go and drop them, organize food for them, organize this. They are driving around in their personal vehicles, personal cars. So I think boys in this case probably have a,
Yeah.
worse deal than the women do. I think it's not, I think we have a better time. Just probably giving the bouquets is a better thing than going to the airport for
No,
people.
no, no, no,
No,
no.
no.
Another
See,
point.
That's the overall
just
concept of it. Yeah, I know,
just
Sona.
just to make a point, what I do in my department is, if the role of looking after the food and serving goes to the boys, not to the girls. I make sure it's the boys who do it. It's okay. Like,
Ma'am,
make sure.
I want to make it like it sound better. There is nothing wrong in serving or
Correct.
greeting someone. The point is the person who is doing is not even introduced as who, and you are not treated as a person who you are. It is not
So,
about the act. It is not about the act of doing it. It is about the way you are treated. You are treated like, I don't know. You have to hold bag. Hope I'm making it clear. You have to hold their bag and walk behind. If I have a guest in my home, I would do all of that, but I would do it with, I feel like doing it.
Okay, I have an incident. Can I quote two
Yeah,
incidents?
please.
Nice ones. So everybody knows Dr. Shetty from KLE's Belgaum, if you've studied there. So my husband, when he joined post-graduation, first day he wanted to catch his bag. So he didn't let him. He said, but he was carrying bag of his teacher who was also teaching there. So my husband asked him that when you are carrying your, that senior's bag, why can't I carry yours? Because, so he told that you carry my bag when you finished your post-graduation. And I remember sir had once come, I was just starting postgraduate and my husband was not there. So sir had come, he was picking up my bag. So in Belgaum, one thing was for sure, the teachers, they never told us to do all that. And number two, when post-graduation came to our college, which is in Punjab, do you know all the HODs and staff were called and we were told that these are postgraduates. They are not your personal property. And the words were used. You cannot ask them any favor. You cannot ask them to do any personal work. And that was Dr. Baghi and Mr. Ahuja, who was the chairman then. We were not allowed to give them, and not allowed to even give one person. And that became a habit in 10 years. I mean, we were not allowed to even, rather we do things for them. I remember my postgraduate got me some little gift. And I was like, please don't do it. It's not needed because, that's what happens in our institute. And like you said, the staff members, I go everywhere. And now that it's turning anyways, the postgraduates are becoming more empowered than the, teachers. So it's more difficult now. So that is what I think the management can, call for a meeting, and yes, the soft skills or human resource department, and they could, look into these small things and have student representatives and know what they feel. Maybe most of the people, Soumya, don't even know that this tradition, they thought that this is a norm. They don't even know what, the children are feeling about it. It started way back, and we are continuing with our eyes shut and not really thinking about it. Now that you've said, even I've realized I was not even,
We started because we have moved to now, like we were talking about the main topic of discussion about women. So I told this about it yesterday to ma'am, because I felt especially women, those girls. So that has to be definitely, and it is very easy to stop.
Yeah.
It is very easy. Nothing is going to be, what is the need at all? There are so many issues with.
I want to add something very positive about this whole thing also. See, women know when we are younger, things are very, very different. But after the age of 45, 50, when you have kind of settled in and when you are practicing, being a woman practitioner is far, far easier. And I think, I wouldn't say beneficial, but patients trust you more as a woman. I have an endodontist who's a man. They'll say, "नहीं वो आप करो ना treatment, please." They find more confidence in a woman. So we have a big advantage being a lady. I definitely feel that.
You think
Especially,
so?
when you've gone through all these other personal problems. But when we are with a patient, they tend to treat you with more, they think that you're more compassionate. And a patient base is much better. And also, I think we do have more compassion, not only because of the dentistry which we have done, but because of all the life experiences that we go through, like caring for your children, caring for your elder people in the family, everywhere. So I think it's a big positive being a lady as a dental practitioner. That's what I feel, especially now after the age of 45, for sure. And I think we should stop comparing ourselves with the male counterpart. Don't do that. Don't have guilt because you're not doing what the man is doing. Think about what you can do. Don't think about what he can do and how you can compare. And make sure that you have your own head high. If you are confident and not guilty, then everybody will treat you exactly how you are looking at yourself. Don't wait for somebody
Happy.
to give you the respect. You give yourself the respect. If you respect yourself, everybody will respect you.
Yeah.
That is very true. Now we are going to get one last thing, and that is this was there at our time. It's I think much less now, because things like the rules came into existence about sexual abuse, which included verbal making somebody verbally uncomfortable. Because of course within the settings, I have never really personally come across a situation where there was a physical abuse in any form. But there was a time where, we had these odd situations, like this odd, and it was just literally, I think in all these years, maybe 3 or 4 people I have met like that, not more. But they were there. And where things would happen, like you would have this odd teacher who would come for an exam, or who would sit for an exam. And I was just telling Dr. Mala yesterday, and you're there, just suddenly every question asked from the girls would suddenly be STDs. Now you can't really say he is. I mean, it's not a case you can literally take even to the dean, or you can, because I mean it is within the syllabus, right? But you get a feeling. Sometimes you are sitting there and you get a feeling, and something is amiss, something is not right. Now, in situations like that, what I have always felt is the simplest way is you can just intervene. A long time back, there was this ad about domestic abuse, if you remember, which said, just go ring the bell. When you hear something, just ring the bell and say anything, any nonsensical thing. Do you have sugar? Do you have milk? Anything. It just breaks it. And I think the same in a lot of ways can be done if, especially as we become senior and as many women are becoming more and more senior. In fact, I think I've done it even with people who were just my colleagues. So I was literally their batchmates. But the point is that we need to have that sensitivity, especially as women, and I think even as men, because I think, to be very truthful, men, very many men I know also get very uncomfortable when they see somebody misbehaving in front of them.
Yeah.
You know, and I do realize it's not always possible to literally take someone to the police to file a complaint or whatever, but the best I think that we can do is when, whether it is in terms of abuse like that, you know, where you feel someone is being specifically made uncomfortable, or whether it is in any other way where you feel there is a gender inequality and you are in a position, I think we can just come out and say it. Maybe either say that I think what you're doing is wrong, or maybe divert, you know, walk in, talk about something else, and make the person realize that you're watching and you're aware and you know what is happening.
Yeah.
Sometimes the men are not aware also what they are doing.
Yes,
It
is
is not that
possible,
they want to
definitely,
do
yeah.
that. Is they are not aware that they are hurting somebody, or they are
Exactly.
being mean or being abusive in any way. So sometimes making them aware also makes a difference. I used to be
Definitely.
the internal examiner, and there was I was the internal examiner, and there was the external examiner who had come. And every time a female student would come, he would have this sly smile, something. First, second, third time, I didn't say anything. The fourth time, I said, I think, sir, what you're doing probably is not right. You don't realize it, but it's you are doing this to the student. Maybe we should stop that. And he immediately stopped it. If I had not pointed out, it would have gone on forever. He felt, he was embarrassed also about it. So maybe just being open about it and just matter of fact say that. In no, not putting him down or not telling him that, oh, you're wrong, you're doing like that. Just, I think it doesn't feel right. I think that also changes.
Definitely. You know, sometimes making, like, you make a decision on the spot and decide what is the best to handle it. But whichever way, I think we have reached a point that we have to realize that keeping quiet is not handling it.
Yes.
Turning an eye, turning a blind eye, and acting like it's not happening
Yeah.
is not handling it.
You can't sit on the fence for this, for sure. And number two, yes, and also be with the younger colleagues. Hand holding is what I think is our role to be. That's what we have to do.
No, and see, this becomes very magnified in the workplace, because these are the people that you need to meet day in and day out. I mean, I am one of the most, I was, even when I was not the HOD, I was the senior most in age in my department. But I have faced the situation. I have faced a situation where I used to be almost stalked by one of my colleagues. They would sit in a place where it was all glass, and then you just watch me going from one patient to the other. It was not a sexual kind of stalking, but it was like like male female kind of gender kind of attitude, that he felt he could do that because he was a male colleague to a female colleague, which was very, very unsettling. And see, the thing is, it's very difficult to make too much noise about it. I was very subtle about it. I did make a complaint, but it's very difficult. The same person also got into trouble commenting on yesterday Samya was talking about leggings, on how a postgraduate student was wearing very tight leggings, and the complaint came to me, and this postgraduate was really very upset, and then I had to smooth things over. So in fact, when I called this colleague and I told him that, see, this is a complaint that we have got. In fact, I had to tell the HOD, you don't get involved. I will do it. I will handle it, because I think I'm better off handling it. And then, but he was so defiant. He said, okay, let her complain, let her do this, whatever. I don't care. Let her call her parent. And I said, see, in all this, only you will look bad. So let's just stop it and make sure that doesn't happen again. I'm not going to let it escalate any further. So it's like that. See, I think some people are like that, so you really can't help it. In fact, this same colleague, one of my female colleagues, refused to share a room with this person. She said, I really don't like the way he talks. I don't like the comments he makes, So I had to respect that. And I said, okay, fine. So sometimes people really know what they're doing, and they know that they can do it because they are men and you are a woman. They are very well aware. Those are the ones that are very difficult to handle. But we just have to. Like Mandana said, you have to address it, and but it's difficult because they really know what they are doing. It's not that they are unaware.
It is very difficult. And although they are really very few, but they are oh such pains.
Very
Yeah, and they sometimes take advantage of the so-called sense of humor, and so
Yes.
those very sidey
Yes.
comments where
Yes.
you don't
That's
know whether
the-
you are.
that's
It
the
is a
worst.
situation
That's the
where
worst.
you are made to feel that you are too sensitive, and it is just a joke.
Correct.
So in such cases, we learn so I have always been I have been lucky. I have been surrounded by all my teachers were very, rather I say I was pampered, like taken care of well. I never had to face one of these, but definitely I'm aware that it is happening. So one such time somebody they will use the advantage of this so-called sense of humor, and then what do you do that you cannot make yourself, like it is very difficult to decide how to deal with the situation like that. You cannot match, I don't know, jokes to give it back that way. You don't feel good about it later, or you make yourself obviously look very awkward, like you are awkward, then they are happy. So sometimes, like, I had to deal, I just said it like, sir, actually, do you know what is my problem? I have never met people like this before, so I'm not very experienced. I don't know how to give it back, but I'm learning. So sometimes in a very elegant way you can get away, and they also get a message that it was a joke with a very bad taste.
What taste?
And you also can be, you don't have to drop your standards. You can just say, I'm learning to deal with people like you, or so that they know that you have understood, you have not taken it, it has not gone
Draw
down.
the boundaries. Yeah, draw very. What I do is for everything there's a boundary. So let the boundaries be in place.
Yeah.
And you're way younger. You learn it. You in the end, when you come to my age, so many things will automatically shed off. You won't even react. They won't even need your reaction. They'll just
so
be a
have
smile.
just like an indifferent attitude towards
Yeah,
them.
my favorite quote is when somebody is trying to unsettle you, and there are many that come on a daily basis in my life too, is just sit back and smile. Nothing unsettles them more because their main aim is to unsettle you, and here you are so unsettled and so sure, and you just smile. They'll hate you for that.
Don't give them a reaction.
Yes. Nothing.
Yeah.
Yes, that is true. So let's see what our
Somebody
audience
is
has to
really
say.
being mean to one of our junior colleagues, or for that matter,
Yeah, of course, of
like
course.
ma'am said, then we definitely need to intervene some or the other way.
Very true.
We cannot just like that let it happen.
That is true.
Yeah, you would know where to take action and where to just draw your boundaries and move away. So that is something that will come with every experience that you'll go through. A lot of situations will basically shape our reactions to them.
Something we eventually find out in life as and I think every one of us is in different stages of doing that, is that you reach a point where you decide to choose your battles.
Yeah.
You
Yes.
decide,
Cannot.
this one I can live with, I'm going to just ignore it.
Correct.
And this one I want to fight on. I'm not going to keep quiet about. Because we realize after a point, much as in dentistry, we have not had that much of problems, but there have been, I think, points of time where in imperceptible ways things have happened, and where you realize after a point that you can't fight every single one. I have one thing that happened a long time back. 1 minute. First, I'll make one announcement. I think anyone on YouTube, if you have any comments that you would like to share with us, please put it there in the chat box. So there was this time I was organizing an event, and I was right from back when I was a student, or rather I was just a junior lecturer between my BDS and MDS, and I was very keen. I was all the time organizing events and doing things. And there was this one event. I was the main organizer. I had organized it. It was on a Sunday, early morning. I was walking into the college, and every and I had a little, problem at home, and I was literally looking down as I was walking in. I was not myself. One of the seniors, and I mean real seniors, and who was a very kind man, otherwise, a very understanding, I highly respected him. Okay. And he was also walking in, and as he passed me, he says, "Wow, for the first time, finally, I'm seeing you with your head down in so many years." And I was like, "What? Why would you even notice that? Why would you even think that?" I mean, it was like, I never understood really what he meant. And but it stayed with me. It was not a pleasant memory for some reason. Something at the back of my mind said, no, that was not a good comment. And at that moment, I really thought, and I am very normally, very often have this tendency to say things out, has landed me in immense amount of problems. But at that moment, I could have gone back maybe on that day or at some other point of time and asked him, what did you mean? And I was actually in a conversational enough kind of a relation with him to actually do that. But I decided, no, it's not worth it. Forget
Don't
it.
need
It
to give
doesn't matter.
importance. They
Who
are
cares
already
what he
losers.
thinks?
So as correctly as Mandana and Simranpreet and everybody says, I think we have to decide what battles are important for us. And sometimes, it's very easy to let go also. It's in our own head. If you let go, sometimes it's way better than trying to, keep thinking about it. And that's the best defense, honestly speaking. If they're
See,
trying
like
to
when I
shut down
was
you,
younger, somebody used to come and tell me, you know what that person said about you, and I would be livid, and I would like to go back. And now, 2 days ago, somebody called me up, the same person who hasn't evolved somehow, the gossip queens of the town. So she tells me, do you know what that person said? I said, frankly telling you, I really don't want to know. And believe me, from within, I didn't want to know. Every person has the right to perception. We are not superhumans. I'm not God. I'm just a human being trying to go through my life. So that's okay. Say anything you want to about me. I'm cool. As far as you don't come in and say it to my face, if you do that, then you're in trouble. Otherwise, I'm fine with it.
Yes, that is true.
After
So,
some time, even when they come and say it to your face, you will say, oh, really? Okay. That's what you think about me. It's
I
fine.
still have to get to that phase of life.
Yes.
My Robin
It'll come.
Sharma,
It'll come.
Robin Sharma, Paulo Coelho's, and Brian Weiss. I'll get there.
yes.
Yes.
So, okay, let's see who else is there on YouTube. So, Dr. Nandini has said, good morning, everyone, and it was to very eminent women presenters who have left an impact in society.
Wow, wow.
Thank you.
Yes. Dr. Bindu and Dr. Madhura have both said hello. Suresh Parbande sir is here with us. He has said good morning, and that's nice. Then, of course, a lot of agreements. Everyone has agreed and said that they are sharing very similar stories, and they can understand. Yes. Interestingly, today is a day when our audience is mostly women, I must say. I guess that
Why do
itself
you
says
think
something.
so? Why do you think so?
Exactly. I think that itself says something. So,
Yeah.
yes. And I should have now a men in dentistry and see whether it
No,
gets more people.
exactly.
that would be
See,
very
see,
interesting.
the men are not even interested in knowing what we think about ourselves in dentistry. See, that's that.
That's the whole point.
Yeah,
Yes.
that's the whole
Exactly.
point.
I think we should not have that preconceived notion. I think that's very, very interesting thing what you're saying. Because we always saying Women's Day, women this, women liberation, but for men, they don't have anything that of that.
I actually searched
I'm not feeling
something
very
called
sorry for them. They have had the world for too many thousands of years.
Yes.
And
I searched,
contrary to that, I remember when we used to do wax carvings, I think, or in third year BDS, and we would go to get it approved. So our colleagues, "Tu ja, tera to ho jayega, tu ladki hai," and used to, like,
Infuriating.
No, it's probably because women are much better at doing it.
But that's not what they mean.
That's not what they meant, Sonal.
that's
Now
not-
you're really trying to cover it up.
it used to be like, even if I achieved something, even if I'm good at something, it is like, just because you're a girl, you can,
But I really like some of the men, they have a real nice sense of humor, and they don't always look at it that way. So like we used to have our phantom head work where we do the cavity preparation and all that. We never had a sitting down situation. It was all standing up, and I was doing my cavity preparation and all that, and I suddenly find two of my male classmates are saying something between themselves, and they are passing some comment. So I looked up and I looked up at them, they said, "We will never start a clinic in front of your clinic or next to your clinic. If you go so close to the patient, nobody is going to come to us." So, I mean, some of them have a nice sense of humor. That also, I mean, they say it in a different way. So and those things I can take. I don't mind. Okay, yeah.
Yes.
So I think from so many years, men have been monopolizing all these different professions, and they have been ruling the thing. So when women are entering into the field, they are bound to feel threatened. It's a natural reaction. It's a very natural reaction when you have all the people from out of town coming here and taking our jobs in Maharashtra or anything else. I think it's a similar thing. So I think we need to treat this more delicately and with confidence, because just give them some time also. Speaking from the
Yeah,
medical
and one thing I have observed, that all the men who make us feel really comfortable and who really value us, if you see, they're all most of them, they will have very strong mothers. So I think if we have to, like, not get, like ma'am said, we cannot go and fight with everybody, and if we want to be at terms, I feel sometimes pity at those men who pass such comments or who have such an attitude, because it may be they were never exposed to, or they never came across strong women or who can stand for themselves, so they don't know, they don't know, they cannot accept it, probably they cannot understand. So maybe, to be at peace with.
Not only that,
their own insecurity also.
Yeah, not only that, things are changing in the home front also. Today, you have young men seeing their mothers work. They see their mothers, balancing the profession and the home. They see equal opportunities being given to their siblings. So things are changing. So especially when they see the mother doing that, like she said, strong mothers, it does have a lot of impact on a young male, and makes them respect all women, which definitely these things are changing, because the equation, how the father treats the mother also is very important.
Yeah. See, for us also, how we also look at it. Like the example I gave you, the IKEA carpenter who came was a lady. I would never think of carpenter as a woman. Carpenter had to be a man. Now suddenly I'm thinking, oh, carpenter also women. So it's my perspective. I'm really, I'm a woman, and I think I have a broad perspective about how life is. But still I'm thinking, oh, carpenter woman.
Yes.
So
still, you never thought carpentry was for women. Very true. None of us.
Because years of conditioning in what was basically a patriarchal society. Like when I visited Taiwan, I was surprised to know it's a matriarchal society. And there, everybody, including the daughter, like, all the money has to go to the woman. And you should see the women there. The old women are really in charge.
Don't even I was so very far, dear. Don't go so far. It's a safe in Kerala.
Kerala, yeah. So I wanted to share this.
Yes.
First time I went to Kottayam and I saw a lady, auto rickshaw rider. and her children were there, and they were, when she was in waiting the taxing area, she was also getting her homework done. It was right in front of Government Medical College, Kottayam. I was doing my senior residency there, and the only lady among all the women, and she was an auto rickshaw rider, and she used to read newspaper, The Hindu. It was new. It was new for me. I mean, I used to look at her. And
it is called Marimakkatai, which is the matriarchal system of society.
In Kerala, especially not Kerala.
No. Even South Kerala. Okay. Yeah. Entire Kerala. And before a certain time, even property was divided in a different way. The chunk would go to the women, and the men would just get very little. And men were like caretakers.
We want that back.
So I have a Nair. This was very rampant in the Nair community. So I have a friend, and she said, we had such a great system. Why did we change it? So now it's become like modernized, and the nuclear family, it's become just like any other family.
According to the Hindu Marriage Act, the woman is the property of the man.
Yeah.
That itself is so obsolete, primitive.
And it's so difficult to get a divorce under the Hindu Marriage Act also. So,
and if there's adultery, the man is responsible, the woman is not, because she's the property of the man. Mm-hmm. So we've been conditioned to this for centuries and centuries.
Very true.
It will take some time, but there is a change, and I see a very, very positive change.
Definitely there's a change.
All this, because of the social media and all these other things, I think things are changing a lot because people are becoming aware. I think awareness is the most important. Yeah. Not only women, but men also.
But Sonal, why are our Hindi soaps not changing?
I don't watch them for that reason.
It's impossible to watch them.
Because fantasy too.
I know.
Yes. So, yes, it's been great. So essentially we had some main points now to wrap up. So one of the things we came across was that men who are mean to women are first and foremost, it's their own insecurities. So maybe we should feel a little sorry for them, but we don't need to feel so guilty about it. And it is their problem. They need to learn to sort it out. And the second thing is, of course, I think there are challenges. We all have them, different ways, different things. But in spite of that, many women are making it to really high places. And I think what is now necessary is for the ones, you may not be very high, but whatever level you are, if there is someone junior to you, younger to you, earlier on the career path, who needs a help, a guiding hand, just of a support in any way, I think making ourselves available to them would help. Mentorship is not a big thing in India, but we can definitely begin to think of, starting mentoring youngsters so they know, and make it easier for them to get to where we have got, and then maybe they can get ahead much faster than what took us, because that shared experience can definitely propel their careers ahead faster. And the other thing is to challenge. If you find something really wrong, just speak out, whether it is for ourselves or it is for somebody else. Yes. But just always keeping quiet is not definitely sorting out the problem. We need to deal with it somehow, whether by just saying, maybe by intervening, maybe by talking to the person, maybe by mitigating the situation, or sometimes nothing might work. And I think if a youngster is being really in any form of perceived danger, then we should definitely, as the most seniors, we should step in and even give them the support to take whatever legal action is required to keep them safe and to keep them fine. And I think that is another very big thing where the seniors come in the fray, because if there is ever a situation like that, I think it would be very scary for the youngster deciding probably between what's going to happen to their careers if they take one of their seniors to court or to the police station, and what is going to happen to their safety if they don't. It's really the devil's choice there. And I think seniors can, especially senior ladies, can make a difference there. And with that, I think it's been wonderful talking to all of you. And yes, everyone there just says hi. And so let's take one picture. We are supposed to raise our hand and take the picture. So
Oh,
let's raise the
yes.
hand and take the
Yeah.
picture. Yes, yes. 1 second. Of course, with my hand raised, how do I take the picture?
Long hand.
1 second. Oh, actually, it'll be in the recording. I will take the picture
It'll
from
be
the
in the
recording.
recording. Yes, yes, yes.
Okay, cool.
So Mandana really enjoyed it, and all of you. So I enjoyed talking to all of you. I didn't think I'd enjoy the session so much, but I really enjoyed it. Thank you so much. You were all wonderful.
Thank you.
Thank you so much, ma'am. And I
Thanks.
just want to take an opportunity to thank all the men who have been there supporting all of us, women like us.
Yes.
That is how we are here comfortably.
Yeah.
Definitely, we have to thank all those decent men
Definitely.
Yes.
Yes.
Definitely.
in our family, friends, colleagues, wherever.
Yes. Definitely. All the men who helped us be this strong.
Who were just gentlemen, who were
Yes,
gentlemen.
gentlemen. Yes, definitely.
And the ones who weren't also, because they also contributed to us being so
Yeah,
strong.
they made us stronger.
Yes,
Definitely
that's true.
made us stronger.
That is true. That is true. Yes.
Oh.
Okay.
Bye.
Okay.
So,
Bye.
bye everyone.
Bye. Have a nice day.
Bye. See you all. Bye.
Bye. Bye.
Bye. So, yep. Let me say bye to everyone on YouTube and thank you for being with us today. I know this was a little out of the box and a little different, but yes, it's been great. There were wonderful colleagues and friends I could speak to. Wonderful having had all of you here. Next week, we are going to go back to more traditional, of course, oral pathology, and we are going to have Dr. Asitwa Mondal, who is going to be talking on pediatric tumors of the maxillofacial region. So that will be an interesting session for everyone. Another request, if you have so far not subscribed to the channel, please do so and also share it with others. Thank you. Have a lovely day. See you all next week.